Rwanda will host a global summit on malaria and neglected tropical diseases in June on the sidelines of the Commonwealth Heads of Government meeting in Kigali. The Kigali Summit on malaria and neglected tropical diseases will be the first formal gathering to bring united global attention and calls to action to ending these preventable yet often deadly diseases that have plagued humans for thousands of years. Statistics indicate that half the world is at risk of malaria, with more than 200 million people getting infected and over 400,000 dying from malaria, most of them young children in sub-Saharan Africa. Ahead of that meeting, experts have started a campaign dubbed "Draw the Line Against Malaria" to support efforts to eliminate the disease in Africa by 2020. To discuss this, we're joined by Lilies Njanga, the Africa Director of Malaria No More, of course, in the UK. Then, of course, thank you so much for joining us on our program.
Thank you very much for having me.
Okay, have we as a continent made strides in the fight against malaria? And of course, how important is it to keep on fighting it amid the COVID-19 pandemic?
Thank you very much. Yes, the continent has made progress actually between the late 1990 to about 2019. A lot of progress had been made. Over 7.6 million lives saved, and the numbers brought down by almost 2/3. So we have made progress, but a lot more still requires to be done. And especially now during COVID, when we have seen a lot of attention, a lot of resources go to COVID, and rightfully so, which is good. But again, malaria has not given us a break for us to fight COVID. So these two needs to go hand in hand to ensure that we do not lose all the gains that we have made in the last 2 decades. So the fight needs to be more, but we can learn a lot from the solidarity we are all seeing in COVID, the innovation that we're seeing in attending to COVID. So if we can be able to bring that to the malaria fight, I think this will be much more progress going on into malaria.
All right, so in the research that has been done in fighting malaria, we actually have seen those achievements being made, but so far, if the organization is called Malaria No More, are we likely to obliterate the disease altogether in our lifetime?
Yes, scientifically it has been shown that we can eradicate malaria from the face of the earth by 2050, actually bringing it down by 90% by 2030. So it can be done and we can eradicate it. But again, for us to do that, we all need to do something about it. And I think this is what has driven and what has grown the movement of Zero Malaria Starts With Me.
You know, for people who are not infected and affected by malaria, this may sound a little bit Greek to them. But, you know, when you hear that malaria is spread through mosquito bites, and there had been a campaign to provide people with nets and sometimes, you know, places where there is a high risk of contracting the virus or the disease would be through fumigating the environment. So far, is it the only way of fighting it?
Let me first start by answering whether we all affected. Yes, I know sometimes we may see like, for those who are not living in endemic areas may see it like this is removed from them. But malaria takes about 12 billion USD of earnings from Africa each year. That's a lot, and it affects different sectors differently. If malaria affects us, a nation, then it affects the health system, taking up to almost 40% of the country's resources. So we are all affected, but differently. So there is a need for us to see it in that way.
All right. So far, thank you so much for making time to speak to us on our program.
Thank you so much for having me, and I call on each and everyone to draw the line against malaria and take it upon themselves.
Right. Lilies Njanga is the Africa Director of Malaria No More in the UK.